This is Health Broadcasting Service HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
HBS Radio is who you're looking for.
Insomnia or sleep disorder. Insomnia is a disorder affecting the sleep pattern. It can either occasion difficulty falling asleep, or it might cause difficulty staying asleep. We all need different amounts of sleep. On average, however, adults need 7 to 9 hours of sleep to function healthily. Children require 9 to 13 hours of sleep, and toddlers and babies require 12 to 17 hours of good sleep. You probably would not get enough sleep at night if you were constantly tired during the day. So, what is insomnia? Or what constitutes a sleep disorder? Insomnia or sleep disorder is a widespread problem for adults. The National Institutes of Health estimates that about 30% of the general population complains of sleep disruption, and approximately 10% have associated symptoms of daytime functional challenges. If you are having trouble falling asleep, that is attaining the onset of sleep. Or staying asleep, which is maintenance of sleep, or waking up too early in the morning, you may be suffering from a sleep disorder the doctors call insomnia. So, what causes insomnia? The most common causes are stress, anxiety or depression, noise, a room that is too hot or cold, uncomfortable beds, alcohol, caffeine or nicotine, recreational drugs like cocaine or ecstasy, jet lag or shift work. Shift work is a common contributory factor to insomnia. Shift work refers to any work schedule which is outside the hours of 7 a.m. and 6 p.m. It can be any time, night, early morning, or evening shifts. It could rotate or be fixed. It makes it difficult for a regular sleep pattern to become established. Some illnesses and/or medications can also cause insomnia. Illnesses and medications such as mental health conditions like schizophrenia or bipolar disorder, Alzheimer's disease or Parkinson's disease. Other conditions such as restless leg syndrome and overactive thyroid can also contribute to a sleeping disorder. These are for future discussions. Equally too, medications for these illnesses may also cause insomnia. These things that may keep you from getting a good night's sleep. Things such as long-term physical or emotional pain, sleepwalking, snoring or interrupted breathing, that is, breathing stopping and starting during sleep, otherwise known medically as sleep apnea. Sleep apnea could be quite obstructive, making a good long restful sleep almost impossible. If you have been able to identify this with the help of someone close who has observed you while sleeping, you should book an appointment with your health professional, as this can be a sign of a more severe problem if it is not properly diagnosed and treated. Other contributory conditions could be narcolepsy, a rare long-term brain condition whereby a person suddenly falls asleep anywhere, inappropriately. Nightmares or night terrors also can contribute to young children's insomnia. Insomnia is treatable via behavioral, psychological, medical components or some combination. You and your doctor will have to talk through your situation and the history of your insomnia, its origin or causes, to decide the best course of treatment for you. How long insomnia lasts is determined by its duration. Acute insomnia is brief and is often triggered by life circumstances, for instance, inability to fall asleep the night before your exam, or after receiving stressful or shocking news. Many people may have experienced this type of brief sleep pattern disruption. This soon resolves without any medical intervention. Chronic insomnia, however, is a continuous disrupted sleep pattern which occurs at least 3 nights per week and lasts at least 3 months. Chronic insomnia disorders also can occur due to other peculiar circumstances. For instance, changes in the environment, unhealthy sleep habits, shift work, other clinical disorders which a qualified medical doctor is best able to educate on. Some medications could lead likewise to a long-term pattern of insufficient sleep. If you suffer from chronic insomnia, you are better consulting a medical doctor for proper assessment. You may benefit from some form of treatment to help you get back to healthy sleep patterns. Chronic insomnia can be comorbid, that is, it is linked to some other medical or psychiatric issue. It is sometimes difficult to understand this cause and effect relationship. In the year 2005, the National Sleep Foundation, the NSF, conducted a poll in the outcome of which over 50% of the people who took part reported at least one symptom of insomnia. Majority stated having difficulty falling asleep, waking up a lot during the night, waking up too early, and or not being able to get back to sleep, or waking up feeling refreshed at least a few nights per week within the past year. 33% said they had at least one of these symptoms every night or virtually every night in the previous year. The two most common symptoms, experienced at least a few nights a week in the past year, were waking up feeling unrefreshed and waking up a lot during the night. Again, a year 2002 National Sleep Pattern (NSF) poll found that 63% of women versus 54% of men experience symptoms of insomnia at least a few nights per week. Other polls have found interesting trends associated with insomnia. For instance, 68% of adults ages 18 to 29 report experiencing symptoms of insomnia, compared with 59% of adults ages 30 to 64, and only 44% of people over the age of 65. Not surprisingly, parents report more insomnia symptoms than adults without children in the household, 66 versus 54%. Health Broadcasting Service is currently conducting a sleep pattern survey. If you would like to take part, please contact us by email at contact@healthbroadcastingservice.com. People with insomnia can feel dissatisfied with their sleep and usually experience one or more of the following symptoms: fatigue, low energy, difficulty concentrating or outright loss of concentration, mood disturbances, and decreased performance at work or at school. Although insomnia means you regularly have problems getting to sleep, it usually improves by changing your sleeping habits. How can you check to see if you are suffering from insomnia? You have insomnia if you regularly find it hard to go to sleep or if you wake up several times during the night or lie awake at night. If you wake up early and cannot go back to sleep. If you still feel tired after waking up or find it hard to nap during the day even though you are tired. If you feel tired and irritable during the day. Or if you find it difficult to concentrate during the day because you are tired. You can have these symptoms for months, sometimes years. If listening to this broadcast, you have now been able to confirm that you may be a sufferer, do book yourself in to talk to your doctor immediately. Treating insomnia, yourself. Insomnia usually gets better by changing your sleeping habits. Try these. Go to bed and wake up at the same time every day. Only go to bed when you feel tired. Relax at least 1 hour before bed. For example, take a bath or read a book. Make sure your bedroom is dark and quiet. Use thick curtains, blinds, an eye mask, or earplugs. Exercise regularly during the day. Make sure your mattress, pillows and covers are comfortable. Do not smoke or drink alcohol, tea, or coffee at least 6 hours before going to bed. Do not eat a big meal late at night. Exercise at least 4 hours before bed. Do not watch television or use devices right before going to bed. The bright light makes you more awake. Nap during the day. Do not drive when you feel sleepy. Do not sleep in after a bad night's sleep. Stick to your regular sleeping hours instead. If you are thinking of self-medicating, exercise caution. The question is, can a pharmacist help with insomnia? You can get sleeping aids from a pharmacy. However, these cannot get rid of your insomnia, and they have many side effects. The downside of sleeping aids, unfortunately, is that they can often make you drowsy the following day. You may struggle to get things done the day after. You should not drive the day after taking them. So when should you see your doctor? It is time to see your doctor if changing your sleeping habits has not worked or if you have had trouble sleeping for months. You should also see your doctor if your insomnia is affecting your daily life in a way that makes it hard for you to cope. Before rounding up this segment, these are 10 practical tips that may help you to beat insomnia. First, please note that simple lifestyle changes can make a world of difference to your quality of sleep. Follow these 10 tips and see if they can help you achieve a more restful night. Maintaining regular sleep hours. Going to bed and getting up at about the same time every day will program your body to sleep better. Choose a time when you are likely to feel tired and sleepy. Create a restful sleeping environment. Your bedroom should be a peaceful place for rest and sleep. Temperature, lighting, and noise should be controlled so that your bedroom environment helps you to fall asleep and stay asleep. If you have a pet that sleeps in the room with you, consider moving it somewhere else if it often disturbs you in the night. Ensure your bed is comfortable. It is difficult to get restful sleep on a mattress that is too soft or too hard, or a bed that is too small or too old. Exercise regularly. Moderate exercise on a regular basis, such as swimming or walking, can help relieve some of the tension built up over the day. Make sure that you do not do vigorous exercise, such as running or going to the gym too close to bedtime, as these may interfere with your ability to maintain good sleep. Plan your exercise regime to promote a healthy sleep pattern. Cut down on caffeine. Cut down on caffeine in tea, coffee, energy drinks or colas, especially in the evening. Caffeine interferes with the process of falling asleep and prevents deep sleep. Instead, have a warm, milky drink or herbal tea. Do not overindulge. Too much food or alcohol, especially late at night, can interrupt your sleep patterns. Alcohol may help you to fall asleep initially, but it will disrupt your sleep later in the night. Do not smoke. Nicotine is a stimulant. Smokers take longer to fall asleep, they wake up more frequently, and they often have more disrupted sleep. Try to relax before going to bed. Have a warm bath, listen to quiet music, or do gentle yoga to relax the mind and body. Your doctor may be able to recommend a helpful relaxation CD.
Write away your worries. If you tend to lie in bed thinking about everything you must do tomorrow, set aside time before bedtime to make plans for the next day. The aim is to avoid worrying about doing these things when you are in bed, trying to sleep. Keep a good to-do things list written in your diary. Resist the temptation to carry them on your mind at bedtime. If you cannot sleep, get up, do not lay there. If you cannot sleep, do not lie there worrying about it. Get up and do something you find relaxing until you feel sleepy again, then go back to bed. If lack of sleep is persistent and affecting your daily life, do make an appointment to see your doctor. I hope you have learned one or two things. If you have questions about the issues covered today or should you have any other general questions about the topic, do send an email to us at contact@healthbroadcastingservice.com. We will round up this important topic of insomnia on this note. Our promise to you is to bring you relevant health information from time to time. Today's segment has been brought to you by the Health Broadcasting Service HBS Radio Channel, UK. Remember to stay abreast of our other broadcasts by subscribing to our channel to receive future useful, helpful, and beneficial episodes. We will be back again soon. And until then, it's bye for now.
You've been watching the Health Broadcasting Service YouTube channel. Your channel of excellence and distinction. Pioneering specialist radio broadcasting. Giving you the best experience. Subscribe to our channel.